Welcome to this adult education senior university session, The Empowered Caregiver, Communicating Effectively. The presenter for this session is Linda Curley. Linda is a Lake County Purdue Extension educator of health and human sciences. She is also a community educator for the Alzheimer's Association. Thank you for joining us, Linda.
We are going to be talking about communicating effectively today. And one of the reasons why I do so many of these programs in Lake County, as I have mentioned to those of you that have been on the session before, is that we have a large number of folks who are either giving care or have been diagnosed with Alzheimer's and dementia in Lake County. In fact, the number is greater than any other county in the state of Indiana. So those of you that are joining the call today, I hope this information will be useful and beneficial to you. And I also want to preface the title here by saying that communicating effectively, we don't want to just think about how you are communicating with the person that you may be caring for who has Alzheimer's or dementia, but how is it that you can communicate your needs to others as you continue to care for someone? So I want you to think about this topic in two different ways. How do I communicate to help another individual, but how do I communicate also to help myself? All right, so let's look at some learning objectives for today. We certainly want to explain how dementia affects folks who have been diagnosed with a disease and their communication skills. As we know that dementia can affect people in the early stage where it's affecting their daily life a little less than it will be as the disease progresses. So we really want to think about how it is that I can communicate best during the various stages of the disease. We'll describe how a person-centered approach can help with communication. And those of you that haven't heard of a person-centered approach before, we will be discussing that so that you might even change your thinking. If you're having trouble or you're struggling with communication skills, maybe this will change your thinking and maybe it can be helpful to you. We'll list some strategies to help you communicate well with people living with dementia or the person that you're caregiving for or with. And also, how do I communicate with folks around me to talk about what my needs might be, where I need help, what kind of plans are you putting in place? So that might be helpful to you to think about as well. And then identify ways to improve communication with your friends, your family, and your healthcare provider. I think that last piece, the healthcare provider are professionals that are helping you. They are part of your team. Oftentimes we are flustered about what to ask, and so we'll give you some tools as we move through the presentation today. So let's first look at this, delve into what is communication. So in terms of the presentation today, it's certainly how we tell people what our wants and needs are. And you can imagine how difficult that can be for a person who is in fact having trouble thinking through thoughts and planning and decision making and maybe losing train of thought. So this can be difficult. It is also how we share our thoughts, feelings, and ideas. And again, throughout the course of the disease, this area is affected. And then it's also how we connect with one another. And that is not just what we say, but it's certainly our actions, maybe our facial expressions, maybe our gestures, body language. We'll look at that today. So let's give you a little knowledge check here. Which of the following are ways that people communicate with one another? So hopefully you might have thought about answering at all of the above. So communication comes from our words, our attitudes, our tone of voice. It comes from, again, our facial expressions, our body movements, and it includes our listening as well. Do you remember during COVID when we all wore masks? And oftentimes it was hard to understand what a person was saying or to get their facial cues, their social cues that we often have within our facial structure. So that was very hard at that time for us to get very used to masks because we were blocking a huge part of our communication. And so we will certainly be talking a little more about those different types of communication today. For this idea of dementia in communication, there are some other ideas for us to think about. So, how does dementia affect our communication? Um, Alzheimer's and other dementias causes damage to our brains. And as I mentioned in the earlier slide, these changes affect our memory, our thinking, our behavior, and certainly our communication skills. One thing that's very important for us to remember as we are trying to communicate with an individual who has been perhaps diagnosed with dementia or any type of dementia, Alzheimer's included, that we shouldn't take this frustration out on a person. The communication changes are caused by the disease. And it's very important for us to keep that in the backs of our minds so that we realize this person didn't ask for this. They are having trouble communicating, and we have to do the best we can to communicate as well. So let's look at communication changes that are often the earliest sign of dementia. These are things that perhaps some of you that are giving care at home or you know someone who is struggling right now, maybe with the early signs of dementia. It is often difficult for someone to find the right words. So they may really have to pause and think about the word that they're trying to grab. Now, this happens with many people. There are lots of people in our busy world that forget words, but this continues to happen so that it affects a person's daily life. Repeating familiar words or phrases or stories again and again, simply because this individual might not have remembered that they, in fact, told this story or used that word and continues to use it. Describing an item when they can't think of the word for it. So I don't have my watch on today. I'm holding my wrist up. Hopefully you can see it. But if I had a watch on, I just use the word watch. But for someone with dementia, they may say that it's a wrist clock because they can't think of that word that says watch. So oftentimes words are connected to help to describe simply because those are the only words they can think of at the time. Forgetting what you're talking about in the middle of a sentence now, this is something I do all the time because, again, in this fast-paced world, we often will kind of get off in a tangent. But again, this is something that happens on a pretty regular basis and starts to affect everyday life. Difficulty organizing words in a way that makes sense. Going back and speaking in their native language. So if English is not their first language, sometimes it's easier for an individual to go back to their native language and will continue to speak in that native language, just because of the fact that they have such a strong long-term memory of that. Speaking less often is a big one that happens quite frequently, where people say, I can't even follow a conversation with several people involved, so I'm just going to be as quiet as I can, almost to demask or disguise the fact that I'm really having difficulty here. And then hand gestures being used more than speaking. So maybe pointing to something that an individual wants or moving their head to that object versus finding the words and speaking. So we're going to talk a little bit now about using a person-centered approach to communication. So a person-centered approach means that you use what you know about the person and adjust how you care for them and communicate to them based on their unique abilities and preferences. So you as a caregiver, probably know this person better than many others, or maybe even anyone else. And so, as you think about perhaps a lifetime with this individual, or even if you've just newly been introduced to this person and you are just providing care in a professional way, oftentimes it's important for us to kind of look into that experience a little bit more to say, what am I seeing that this person really enjoys? What are the things that are making this person more frustrated? And what do I know about what they've loved to do in the past? This approach can help you communicate with someone living with dementia better because of the fact that you are looking into the individual to say, how can I best care for them? Knowing what I know about them, knowing those things that they like and dislike, those things that they've always loved. Maybe they've always loved to hear about what the grandchildren are doing. Well, then that's still part of the discussion. Maybe having those discussions with an individual more frequently, knowing how much they once enjoyed hearing about what the grandchildren were doing. So we're going to look at this approach, a few tips, and we'll dive in a little bit more to how we apply this person-centered approach to communication. Number one, treat them with respect and dignity. And I kind of touched on this in the beginning of our discussion today, or the beginning of the presentation today, when I said that if a person is having difficulty communicating, following directions, doing the things that you had hoped that they would do, please remember that this is the disease that is affecting this person. This isn't the choice of the person that you are helping and supporting. So use that knowledge of the person's likes, dislikes, and even communication preferences. Does this person like speaking things to you? Does this person rather write down notes or that you communicate saying we're going to the doctor at 1 o'clock and maybe putting a circle around it? Maybe that's the preference that an individual has. So keep thinking about where you see things working well and how you can move forward with that in terms of a person's likes and dislikes. Call the person by their preferred name. And you might say, well, that's a real odd one. Instead of saying honey or sweetie or buddy or whatever you may prefer to use yourself, it's really important that you're direct with the person and call them by their name, the name that they've used for many, many years, so they really do know you're speaking to them. Avoid talking about the person as if they're not there. I often do presentations in the community. Many people will bring their loved one who may be experiencing the early stages or the early mid stages of the disease. And I always feel incredibly uncomfortable when a person will talk about the person that they've brought with them, maybe their partner, right in front of them as if they're not there. So again, avoid talking about the person as if they're not there. Include them in the conversation, and certainly make sure that you're asking questions. Please avoid correcting them. They are giving you information based on what they believe they remember. And the more that you try to correct them, the more frustration for both of you will occur. Again, this isn't the person asking to be difficult. This is what their brain is telling them at the time, and this is what their brain might be remembering. So please avoid correcting them. And then validate their feelings. If they are saying, I'm very frustrated, I'm trying to say something and it's not happening, validate their feelings and try to figure out another path. And maybe that path needs to be a little more simplistic. Maybe it's not the path that you've used all your life. How can you simplify a process or a yes/no answer or just two choices instead of many? That might be helpful to to your communication as well. Number two, Include the person living with dementia in conversations. As I said earlier, that's very important, but there are other tips here that we want to share with you. So be sure that you're talking directly to the person. So can you imagine if I'm in the refrigerator and I'm trying to figure out what to make for lunch, and I'm looking at everything in the refrigerator and I'm saying, "Do you want turkey or should we have ham for lunch?" And this individual is really just seeing you look into the refrigerator and they're not even sure that you're speaking with them. So a good idea would be to survey the refrigerator, then turn to that individual and give them a few choices as to what might be on the menu for lunch. Speak slowly and clearly, maybe a little more slowly and clearly than you have in the past, simply because you do want this person to have the best chance of understanding what you're saying. Remember to use a calm tone of voice simply because an individual may feel very frustrated and feel that the situation is getting a little more elevated if in fact your tone and your voice is going up along with perhaps some frustration you may be feeling. Always acknowledge what the person has said to you so that they do know that you heard them and that you're moving on with the conversation. Help them engage in conversations that are meaningful to them. So, as I said to you before, what is it in their past that they were most interested in? Maybe they really like to watch the Final Four basketball. And so you might say to yourself, well, that's a little bit hard for them to follow on the screen and frustrating. So, why don't we talk about the teams that are in the finals? Why don't we talk about some of the players and maybe how tall they are or what skills they have that is making them so successful in the game? So figure out ways to make sure that conversation becomes more meaningful to them. Have conversations about family and friends that are in your lives, including things that you have done together. So maybe revisit, take a stroll down memory lane with this individual. Maybe say, "Do you remember when we went to prom together? Do you remember the day we got married and such happened? Do you remember when we got our first dog and what his name was or her name was?" So, again, maybe take a stroll down memory lane and have some conversations about friends and families, things that have happened in your lives, and then echo with the things that are happening right now. Number three, be patient. Always give a person time to decide what they want to say. So we in this fast-paced society feel like the conversation needs to move and we want instant this and instant that. But for a person living with dementia, it is difficult often for them to grab every word that they want to say. And so give that person the time to figure out what direction they're going, because I think if you were to put the shoe on the other foot and somebody continued to interrupt or guide the conversation every time you opened your mouth, I'm sure the frustration would be there as well. So avoid interrupting. Try not to speak for them unless, in fact, that time comes when, in fact, you have to maybe prompt or do those kinds of things. Make sure you give them choices, but not so many choices that it's problematic. I think those of you that were on the call the last time that we did one of the empowering caregiver sessions, we talked about, instead of saying it's time to take a bath, give them an option to say, would you like to take a bath or a shower today? That empowers a person a little bit. It helps them to understand that not all of the choices that they've made all their lives have been taken away from them. And it's respectful and it gives them dignity. So give choices, but certainly not so many choices that it's overwhelming. And then remember to connect in the moment. And what we mean by that is maybe touching a person on their shoulder, touching a person on their hand. For you to give a gesture like, I understand, I love you, I'm here for you. Sometimes those gestures mean more than words to an individual. So always think about the five senses as well. Think about your touch, what you're saying, maybe a certain smell or scent that might be favorable to a person. Think of all of those things as you continue to learn to communicate with an individual at a different level. This is a biggie. Limit distractions. And the tips here are really about trying to avoid all that is going on around us in order for an individual to be more focused. I'm going to give you an example of something that happened in the room here earlier, just because I'm sure that it could have been distractive to you if you were hearing it. I know that it was distracted to me as I continued to communicate with you. So it just so happens that we had the door open and there were some people in the hallway that were talking. And as we age, I hate to say this, but as we age, distractions like that are often problematic to us. Sometimes you're in a room and somebody's whispering behind you and you're trying to focus on something ahead of you, and it's very distracting to you. The same is true for an individual who has been diagnosed with dementia. So find a quiet place that has few distractions, especially when you want to communicate with an individual. This will help them to be kind of one-on-one with you. Get rid of extra noise and visual distractions. So if the television is on, turn it off or turn it down if the individual still wants to see what's going on the television. If there's a radio on in the room or music on in the room, or you're in a crowded area, maybe a mall, or you're at a holiday party with family members, and the distraction has gotten to be too much, again, try to get rid of that by removing yourself. Having a one-on-one conversation is important, but remember, you want to be at a person's level. So if a person is seated, you want to sit next to that individual. If a person is standing, then stand and be on that person's level. Like I said earlier, if your face is in the refrigerator trying to figure out what's for lunch, it's hard for that individual to know that you're speaking to them. Keep your conversation simple. So what may have been a process of many steps for you to get from point A to point B with this individual, perhaps you think about, what can I cut out? What do I need to say that's very important? How can I guide this person, maybe by their hand or by a soft touch on the back, to say, we're going to do such and such now? And these are ways for you to keep your conversation simple, have some body language involved where you're guiding and you're making this a little bit more simplistic for this individual. Turn off or turn down the sound on the TV, as we said, and then put your phone away. If your face is in your phone, it's hard for the individual to feel like you are speaking with them. Okay, remember that nonverbal communication. I've inserted that in this program quite a bit already, but just because of the fact that I think it's so important, and I think we missed some nonverbal communication during COVID, and it became so apparent to me, especially with young children, how important our facial expressions are. If I am, if I'm frustrated with an individual and I'm trying to use a tone in my voice that isn't so alarming, but my face is showing that I'm angry, my face says a lot. So again, let's check those nonverbal communication skills. So use positive body language and facial expressions. So if you want to say, boy, do we want to take a bath or a shower today? Again, it's that smile on your face so that it's like a good choice to make versus, all right, do we want to, again, it is this idea that I'm willing and able, let's do this together versus here we go again, okay? Use your hand gestures, like pointing to an object. So if you say, do you want to go outside? Let's get in the car. And you're pointing to these things that can certainly help an individual to say, oh, we're making a connection here. And honestly, we use hand gestures and we have all our lives. So it may be the hand gesture that a person sees and recognizes because you may have been using that hand gesture all your life. You're just using it as a better tool now. Make eye contact. I covered that already. That gentle contact on the back, on the hand, just to let the person know that you're there. And it can be that guiding force to say, we're going in this direction right now. So touch, sight, sound, and taste are incredible ways to communicate as well. So we're going to listen to a couple of caregivers talk about their experience when they're encouraging nonverbal communication, and also this idea of a patient or a parent, a person-centered approach where you're thinking about connecting through shared interests. So let's listen to the first caregiver.
Some of the changes I noticed in the middle stages with mom would be she would start to point to things versus saying them. So, for instance, she had a fascination for airplanes all her life. So we would be driving, and she would just, when she would see one, she would point to the sky. In the early stages, she would say things like, "Oh, the last one for the night that we see, the last airplane." And the middle stages, it was more just pointing. And so when that would happen, I would say, "Oh, there's the last one for the night, Mom," right? So I would be that voice for her at that point. I knew what she meant, and so then I tried to supplement it with some words myself, and then maybe she would actually repeat it or say, say something in regards to that. So then I knew she was engaged in that conversation.
Gosh, that's so powerful for her to have seen those words or heard those words in the past and noticed that those were not words that were being used. And so to try to supplement the action or the pointing, I just think that's beautiful. Here's another experience to share.
When my husband was in the late stage of dementia, I would always sit and talk with him. I would try to use a calm tone of voice. I would always make eye contact, give him hugs, hold his hand. But sometimes it was hard for me to think of new things to tell him. I didn't know if my words were too complex. But one thing that we had always shared was a love of the Harry Potter books. And so I made sure that I always kept a Harry Potter book in his room. And sometimes a visit for us would be holding hands, and I would just read a chapter from a Harry Potter book. And that was actually really connective and important for us because as a couple, we had a lot of memories of reading those stories together. And I also was starting to read those stories with our son. So it felt like this way of making a family memory that I could hold on to and share with both my husband and our son.
Another great way to connect and when you listen to some of the information that we're giving you, remember this is great information for any caregiver, not just those that are providing support to someone who has been diagnosed with dementia. And so as you sit quietly and read to somebody, there's just such a connection there, especially if it is a book that they've loved their whole life. Again, there's a shared interest and such a great connection here. Okay, so I'm going to give you a little bit of time here to put this into practice. I'm going to read you this little scenario, and then we'll move on to the next slide where you have some options to choose what you might do in this situation based on the information I've given you thus far. So Alonzo's wife, Alicia, is living with Alzheimer's disease and no longer is able to get out of bed on her own. Prior to her diagnosis, she worked at an elementary school as a librarian. Alicia is no longer able to speak, and Alonzo is having a hard time communicating with her. This is making Alonzo feel less connected to Alicia. All right, so here is our screen to give us some options for answers. What could Alonzo do to try to communicate with Alicia and stay connected to her? Hold Alicia's hand as he tells her what he did that day. Put the radio on in Alicia's room. read one of Alicia's favorite books to her, or there's nothing Alonzo can do because Alicia can no longer speak. So a couple here that would be a good idea would be number one, as we talked about this, a gentle handhold or a touch would be a good idea. Putting the radio on in Alicia's room is probably something that would be a little more distractive, right? And we may think, oh, this is a good idea just to have some background noise, and it might make me feel a little less anxious or frustrated. But that's not necessarily helpful to Alicia unless she says, I'd like some soft music in the room. Maybe reading one of her favorite books. I think that might be a great idea, especially if she used to be a librarian and probably has a great interest in some of the books that she was experiencing her whole life. And then finally, we hope that number 4 was something that you thought would be problematic. Thinking that there's nothing that you can do is really something that we would like you to look outside of and to say, no, there's always something that I can do as we move through this disease. So let's talk about communicating well with others. So as I mentioned at the beginning of the program here, this isn't just about you communicating with your loved one that you're providing care to, or some of you on the call might be providing care to patients. It is about your network. It is about the family and friends that want to know more about this individual and what's going on with them, that want to know how they can help. It is about you being able to express your concerns, your feelings, and communicating well with others. And oftentimes we have a tendency to kind of hold those things to ourselves as if we can't express them. Maybe we don't want anyone to think that they can't handle it. This is my responsibility. This is something that you should kind of get out of your mind, because sharing your experiences, seeking help, seeking support is very important to your well-being, to your physical health. You're only as good as you are mentally and physically to help someone else. You're only as good as you are yourself to help someone else, but so you really have to think about that. So tips for communicating well with others. First of all, family and friends. Talk about your feelings, your worries, and your needs, and make sure you're open and honest, because maybe they don't really know how things are going in your household or in your environment. Maybe they feel like you haven't reached out to me, so things must be going fine. Be open and honest. Just know, as we've said before, there is no cure for this disease currently. So this is a progressive disease, and we have to kind of think ahead to say, while I might not need so much support right now, I may need much more support in the future. And what is that going to look like? Who are the people in my network that should be involved in these conversations? So make sure you have the difficult conversations when you need to. We do suggest people have conversations on the front end when the early stages or the diagnosis comes through, because of the fact that the individual who has been affected by the disease or diagnosed with the disease may then have a say in what's going to happen, what their needs are, what they hope for the future. This is an opportunity for you to say, I'm going to try my best to do that for you. Or, boy, we really need to talk this through because I don't know how we can do that. If someone says, listen, I want to live the remaining days that I have traveling the world, is that reasonable for you? Is that something you can do? Or do you need to have a conversation with friends and family to say, this is the discussion I've had, help me through this? And then stay connected and check in regularly with friends and family and your team. And what I mean by your team, it can be your healthcare team. It can be your faith-based team. It can be your family, your friends, your neighbors. Anybody, it could be the Uber driver that picks you up for appointments to get you from place to place. It is all of the folks that you can have conversations with that can help you move through this journey together. So in terms of talking with those healthcare professionals, make sure you're preparing for appointments. So we always suggest that somebody write down a few things that are going on at home that certainly might be new to the situation. So what is the patient doing that's new that you have worries about? Maybe they're having trouble eating and swallowing, and that wasn't something that was happening a couple of weeks or months ago. Write down before you go to an appointment those things that you really want to cover. Because if we don't prepare for appointments, oftentimes it's a very rushed situation and we're in and out of there before we realized, oh, I forgot to ask, blah, blah, blah. So maybe write down 3 or 4 very important questions that you want to ask about. Make sure that the doctor is explaining the details of perhaps medications, methods. Maybe you're going to be in a clinical trial or the person you're caring for is. Make sure you have all the details. And then make sure too that you have given the doctor enough details about what's going on as well. Take notes during appointments or even ask if you can tape record an appointment because we all have selective listening. And you might get home and 3 or 4 people might listen to the recording with you, and everybody's got a different idea about what they heard. So it's important for you to discuss, okay, what does this mean? Do I need to reconnect with the healthcare provider, or do we have a plan? And then think about your environment. So if the doctor is talking to you and your loved one in an environment that's busy and noisy, maybe you're not in a full room, you're in a cubby or something and you're having discussions. Maybe they're talking to you as you're going out the door in the hallway and there's a lot going on in the hallway. Make sure that you think about how disruptive that can be for an individual who's suffering from dementia and ask to like tuck back into that office for a moment while you have that conversation with the doctor, just so it's not distractive to you or certainly to the individual who's suffering from the disease. So that is the end of the brunt of the presentation, but I certainly want to share with you some of the resources that the Alzheimer's Association has for you that I think are so invaluable to folks that perhaps have an early diagnosis. Maybe you are supporting a loved one right now, and it's 2 o'clock in the morning and you're saying, oh boy, there's a lot going through my head right now. The 24/7 helpline, which is on the screen here, 800-272-3900, is enormously helpful to folks. In fact, most people that I speak to, they say, I was just so lost until I called that number. So they will answer any of your questions. They are master's trained clinicians, and they will point you in the right direction, provide you with the information that you need, and that is their sole reason for being there. You can even ask, listen, I want local support. Where can I find local support? So they might be able to find some chapters and support groups, and even maybe a hospital program that can be helpful to you, because lots of folks ask me about these things when we're in programs together. If you are a person that would rather kind of look at things in the privacy of your own home and connect online and maybe print out some material for your loved ones who are going through this with you, the online avenue is a good one as well. So alz.org/care helps you to understand caregiving skills and also how it is that you seek alternative care or additional care. ALZ.org Safety talks a little bit about those things that you can do in your home to make your home safe, and out of doors too. How is it that we're going to keep everyone safe? And then finally, that idea of driving. Oftentimes, it's very hard to make the decision about when a person should stop driving, and there are resources on the alz.org site as well. So all of these are here for you. Make sure that you make a tab or a bookmark on your home computer or laptop for alz.org, because there's just a plethora of information and support for individuals that are caring for and walking in step with someone they love.
Thank you everyone for joining us, and thank you, Linda, for taking the time to be with us today.
My pleasure. Thank you.